Welcome. We are so pleased to have you here today for our final panel in the Yolo COVID-19 Community Needs Series. My name is Jessica Hubbard, and I'm the Executive Director of the Yolo Community Foundation. Please note that our moderator will open the discussion for questions from the audience towards the end of the panel. We'll use the chat box to field those questions, so feel free to enter them as we go or to save them for closer to the end of the session. As noted, today's panel is the last in a 5-part series that has unfolded over the course of the last month. So far, we've covered food insecurity, housing insecurity, mental health, and the particular needs of children and families. After spending these last 4 weeks working to better understand some of the nuance of the major needs in our community, today we'll be focusing on what comes next for Yolo County and our path out of this crisis. This series is the result of the State of the Yolo Nonprofit Sector update that the Yolo Community Foundation developed in November. That update was based on a survey to which more than 40 Yolo County nonprofits responded, as well as close to a dozen interviews with nonprofit executive directors. While of course there was a wide range of critical community needs that came out of that research, and many community groups that are a particular need, the topics we're covering in this series are those that came up over and over as being particularly critical for our local community. Our goal for this series has been to help our community thoroughly understand local needs, to understand how local nonprofits are working to address those needs, and most particularly, understand the critical role that local donors and volunteers play in supporting those efforts. Our hope is that this will enable us to come together as a community to serve our neighbors in need during this current crisis and in the weeks and months that follow. I'd also like to take the moment to thank our generous sponsor, Sutter Health. Without support from Sutter Health, we wouldn't be able to put on this event today. Sutter Health, of course, is deeply involved in addressing this pandemic as a local healthcare organization, as well as an important supporter of our local nonprofit sector. I'd like to share the following statement in Sutter Health's own words. As a not-for-profit organization, Sutter Health reinvests in the communities we serve through community benefit programs that address priority health needs for underserved and vulnerable populations. Community is at the heart of who we are and what we do. Our work goes beyond traditional healthcare, and we extend support outside the walls of hospitals and care centers, which helps improve the health of the overall community. We're thrilled to sponsor the Yolo Community Foundation's COVID-19 Community Needs Series and take part in these important discussions. We look forward to hearing from all the wonderful panelists, many of whom are collaborative partners of ours, and sharing the valuable information learned throughout the series with our organizations. For those of you that are involved in the local nonprofit sector, I know you know how tremendously important Sutter Health is to our local community. And we're particularly pleased to have the CEO of Sutter Davis Hospital on our panel today. We at the Yolo Community Foundation have so enjoyed hosting this series and feel like it's been a privilege to be able to host these conversations. For those of you who aren't familiar with YCF, our mission is to inspire and support giving and to provide philanthropic leadership in our community. Our organization was founded in 2001, and today we have about $7 million in assets across 65 individual funds. In 2020, we made $1.5 million in grants, and we're an affiliate of the Sacramento Region Community Foundation. Our work falls primarily into 3 pillars. First, we work to inspire giving. We do that by offering philanthropic funds, like donor-advised funds and nonprofit endowments, that make giving easier, tax advantage, and more effective. We also work to promote philanthropy through events, media outreach, and other programming. Secondly, we work to support philanthropists. We do that through one-on-one staff support, as well as events like site visits, small group discussions, and expert panels like our event today. In our work with philanthropists, our goal is to provide the education to make donors effective in their giving, the inspiration to help them feel excited about giving, and a sense of connection to a community of peers that is working together to serve Yolo County. And then finally, we serve nonprofits directly. First, if we're able to do those first 2 pillars effectively, we grow local giving and make giving more effective, which is the _1 way that we support our local nonprofit sector. Secondly, we offer funds for nonprofits, such as our nonprofit endowment funds. But then we also do direct grant making initiatives, like the Yolo COVID-19 Relief Fund and our Buck Grant program, as well as professional development programming, primarily through the Nonprofit Leaders Alliance, which is a partnership between the Yolo County Library, and the Impact Foundry. A key part of what we do is offer several types of philanthropic vehicles. These are financial vehicles, somewhat like a checking account or a 401k, but for your philanthropic giving. These funds can simplify your giving because we handle all the back office associated with your grant making, can make your giving more effective by pairing you with staff and other fund holders, and can have significant tax benefits. Our fund holders have access to foundation staff support and join a community of peers that are working together to make an impact through philanthropy. Our most common fund type is a donor advised fund, which is a lot like a private foundation, except with a much lower minimum fund size of $10,000. If you're interested in learning more about how to collaborate with the Yolo Community Foundation, please don't hesitate to contact me at jessica.hubbard@yolocf.org. Now I'm thrilled to introduce our moderator, Evan Schmidt. Evan is an active civic leader, currently serving as co-chair of the board of directors of Empower Yolo, and is a senior fellow for the Nehemiah Emerging Leader Program, as well as a former California Stewardship Network Leadership Fellow. She was recognized as one of the region's 100 most notable business leaders in 2021 and holds dual master's degrees in community development and geography from UC Davis. She's been a Davis resident since 2001. Thank you so much for moderating today, and I will turn it over to you.
Thank you, Jessica. Really happy to be here, and thank you so much for inviting me to be the moderator of this panel. So as Jessica said, this is the final series in a series of forums that the Yolo Community Foundation has hosted, zeroing in on critical issues. Throughout the panel so far, we've been focusing on understanding the critical needs in our community, including food insecurity, housing insecurity, and mental health, which has impacted many of our communities, especially seniors, farm workers, undocumented immigrants, low-income households, and others. As well, we've seen a set of unique needs and challenges for children and families, including childcare, safety, and distance learning. One of the reasons that, that they call on me to be the moderator is also because Valley Vision has been very tuned into the impact of COVID-19 in our region as a whole. We've been doing a series of public opinion polls that looks at just that. These are called the COVID-19 resilience polls, and they look at the experiences that people have had throughout the last year as we've all been experiencing COVID-19. Our public opinion poll has been fielded twice over the last year, so in May and then again in September, and we have another poll coming out in May again this year. So we'll have traced an entire year of what our region has gone through around COVID-19. And we've learned a lot. A lot of it's not a huge surprise. We've learned that COVID-19 has impacted people profoundly, both in terms of their routines, their day-to-day lives, economic impacts, and impacts on their health. So we've learned that people of color and younger people are experiencing many of these impacts more intensely across our communities. These include economic hardships, hardships around access to critical services, affordability of basic needs, and mental and emotional health as well. These disparities and challenges were significant needs in our communities before the pandemic, and the pandemic has magnified and brought a spotlight to the problems that were already pervasive in Yolo County and beyond across our region. And then this series has brought about significant insights as well. Some of the key themes that have been repeated across our panels to date have been looking at deep inequities across racial and socioeconomic groups. So our panelists have reported on the same thing that we saw in our data, looking at our public opinion polls. The panels have focused on the importance of collaboration among nonprofits and government agencies, the intensity of the spike in need in our communities as a result of the pandemic, and also the amazing work of our local nonprofits and government agencies supported by donors and community volunteers and all that they've done to respond. We've learned about the extent to which community members in all corners of our society will have a critical role in building back from this challenging time. And we've also learned about the importance of ensuring that community members most impacted by the crisis have a voice in creating the solutions. So that brings us to today. So for today, this panel, our focus will be less on understanding the nuances of community needs and more on discussing where we go from here. How do we build back in a way that makes us stronger and more equitable than before the pandemic? And what role each of us and our community at large can play in that recovery. So today we'll be focusing on solutions for the future. I'm really excited to introduce our panel, but before I do that, I want to get all of you, our audience, engaged in a poll question. So I'm going to turn to Holly, perfect, and ask Holly to share the poll. So Please respond. On a scale of 1 to 5, how optimistic are you about the recovery for the Yolo community in the coming year? You're highly optimistic at a 5 or all the way down to 1, not optimistic. So make your choice and submit your survey. We'll give it we'll leave it open for just a minute, and then Holly, if you can share our results, we'll see where our audience is on their level of optimism. All right, and can we see that? There it is. Okay, so we had, it looks like our most common response is optimistic. We've learned how to address critical economic, health, and social issues, and we'll do better than we did before. So that's very good. If we go, so if you look at that's 63%, we have 18% that are highly optimistic, 13% that are slightly optimistic. And when you get down into the neutral and not optimistic, we really, we have no responses there. So that's great. Everybody has at least some optimism about where we're going. And we have a few people that aren't quite sure. So that's a great place for us to start. I think we've been in response mode for the last year, and now we have the opportunity, or we're moving into when we have an opportunity to be in reimagine mode. And that's exactly the type of thing we're going to talk about with our panel today. And so with that, I'm really excited to introduce this panel of dynamic and impactful leaders in the region. First, we have Gary May, the Chancellor of the University of California, Davis. Gary May is the 7th Chancellor of UC Davis, one of the nation's most academically and socially diverse universities. His vision is to lead the university to new heights in academic excellence, inclusion, public service, and upward mobility for students of all backgrounds. Chancellor May came to UC Davis in 2017 after serving as Dean of Georgia Tech's College of Engineering, the nation's largest and most diverse school of its kind. In 2015, President Obama honored him with the Presidential Award for Excellence in STEM Mentoring. Chancellor May earned his master's and PhD degrees in electrical engineering and computer science at UC Berkeley. He's won numerous awards for his research in computer-aided manufacturing of integrated circuits. In September 2018, Chancellor May was inducted to the National Academy of Engineering for his success in attracting and retaining engineering students from underrepresented backgrounds and his innovations in semiconductor manufacturing. I'm also very proud to say that Chancellor May serves on the Valley Vision Board of Directors. Nice to see you, Chancellor May. Welcome, and thank you for being here.
Thank you.
Next on our panel, we have Rachel McKinney, the CEO of Sutter Davis. Rachel McKinney has been the CEO of Sutter Davis Hospital since 2018. Previously, she served as Chief Operating Officer for VEP Healthcare and in administration and operational roles in oncology and neurology throughout Sutter Health. During her time at Sutter Davis, Ms. McKinney has led the vision for the expansion of the emergency department, birthing center, and medical surgical unit, which will be completed in 2024, while mobilizing and leading the hospital's response to COVID-19 pandemic. The hospital has been awarded Modern Healthcare's Best Places to Work and achieved top decile performance in quality and patient experience under her leadership. Additionally, Ms. McKinney enjoys mentoring early careerists and is passionate about various community partnerships and the broad impact of working together has on the community. Ms. McKinney holds a Bachelor's of Arts degree from Gustavus Adolphus College in Minnesota and a Master's of Healthcare Administration from the University of Minnesota. Welcome, Ms. McKinney, and thank you so much for being here.
Thanks for having me, Evan.
And last but not least, we have Jim Provenza, the chair of the Yolo County Board of Supervisors. Supervisor Provenza has over 35 years of state and local government experience and a long career in public interest law. For the past 23 years, he has worked as a special assistant district attorney. Supervisor Provenza has a degree in political science and a law degree from UC Davis. His legal career includes representing victims of domestic violence, consumer fraud, civil rights violations, and housing discrimination. He served as counselor to Senate Judiciary Committee Chair, wrote hate crime law and legislation related to criminal justice reform. Supervisor Provenza entered public office in 2003 as a member of the Davis Joint Unified Board of Education, where he supported excellence in education for all students, advocated for special needs children, and helped revamp budgeting systems. Welcome, Supervisor, and thank you for being here. All right, well, I'm delighted to get into our questions. And as we mentioned right before the call started, I'm hoping that we can have a dialogue as we jump into these questions, thinking about our communities, and where do we go from here? So the first question I have is, what has been the biggest shift for your organization, and what have you learned from this time? And Chancellor May, I'll start with you.
Well, thanks, Evan. First, thank you for the very generous introduction. And I want to thank the Yolo County Community Foundation for bringing us together again. I'm happy that we're in a phase that we can talk about recovery and know that much better days we hope are ahead. As for the question, this year was unlike any other that UC Davis has ever known. I think we can all say that. We had to close campus due to the hazardous smoke from the campfire back in 2018, which then was nearly unprecedented. But then this past year required us to pivot to new ways of teaching and working and managing our campus operations because of the pandemic. In many ways, we've had to completely reimagine how UC Davis functions. And that's no small feat for a campus with a student body of almost 40,000 and about 25,000 people who work at both of our campuses. I'm proud to say that we've made the pivot quite well. We continue to offer excellent teaching using remote instruction. We continue to pursue important research while adhering to the public health guidelines. We retained our ranking among the top public universities in the country. We remained on the cutting edge in the fight against COVID-19 and delivered world-class care to our patients at our hospital. During this time, I learned more than ever about the importance of communication and collaboration. And I'm sure these themes will be revisited a lot today. As for me, overseeing UC Davis during this pandemic has required a tremendous amount of coordination. I'm thankful to be surrounded by a team that helps to connect all the dots for me. And I'm very much appreciative of the open dialogue between UC Davis, Yolo County, the city of Davis, and public health officials. Because of all this teamwork, it's no coincidence that we're here today to talk about recovery. So we're showing the country, I believe, what a truly successful town-gown relationship can look like.
Agree more, and I'm excited to get into all those themes more deeply. And there's been so many ways that UC Davis has been in a leadership position to really shape what the response has been and how we've gotten through the pandemic. Ms. McKinney, I'll go to you. What have been the biggest shifts for your organization, and what have you learned from this time?
Thanks, Evan. Well, I'd just like to start also by echoing my gratitude for the Yolo Community Foundation for having us here today. It is an exciting time to be talking about these issues and really to be here on this panel with the Chancellor and Supervisor Provenza. All of us, healthcare, small businesses, big businesses, academics, public health, agriculture, hospitality, all of the nonprofits in our community that make up this great county have all had significant challenges and have seen significant shifts in their businesses over the last year, really just to maintain and survive the pandemic. And working at Sutter Health with our footprint across Northern California, I've been exposed to many different geographies, partners in other counties. And I just really want to say how proud and honored I am to work here in Yolo County and to see the cities and the community members and what makes this community so special. So thank you on behalf of Sutter Health and Sutter Davis Hospital for all of the support from the community that we've received over the last year during the pandemic. There are two main shifts that I'll highlight that I think that really help us to think about the future and the recovery, and those shifts came out of the pandemic. And the first one was our rapid deployment of telehealth. And I think, like so many other health systems across the nation, we had an element of telehealth. And certainly at Sutter Davis, we had brought telepsychiatry to the hospital several years ago. But the pandemic really escalated our strategy around how we deliver care. When the stay-at-home orders went into place, we really had to pivot and execute on a strategy that we had outlined starting in 2021 for the next 2 years. And we actually executed on that strategy in 6 weeks. So the speed to execution and our ability to show that while healthcare is large and cumbersome and complex, that we can be nimble, we can be agile, we can adapt and be flexible and execute on key initiatives that best serve our patients. So that probably has been one of the biggest shifts in how we've seen care evolve. And then the redeployment of our teammates, our physicians, our employees, and really how we had to redeploy, retrain our team when we closed our surgery departments and our surgery centers to prepare for the surge. We took the opportunity to retrain those employees to be able to care for patients in other parts of the hospital or in other parts of the system. We trained about 1,000 nurses to staff and manage our COVID-19 hotline and our call center, because as you can imagine, the increase of calls and questions and concern just escalated overnight. And so being able to redeploy our workforce in a way that allowed us to adapt to the needs of the organization and the needs of the community also showed us that we can be more nimble in how we do that. And so our physicians, clearly with the telemedicine deployment, had to be retrained. We trained over 5,000 physicians to be able to provide telehealth to their patients in a different way. And so I would say those are probably the two biggest shifts that we've seen, that we've been able to learn from and take those into the future. As far as lessons, I mean, clearly the biggest lesson has been how we actually care for COVID patients. When you think back to the beginning of the pandemic and what we were watching, while we were also one of the first health systems in the country to respond here in the Bay Area, just clinically how we've learned to take care of COVID patients has been tremendous lessons, from early putting patients on ventilators to not putting patients on ventilators and treating them with high flow oxygen and treating them with proning, having them lay on their stomach. So just really the evolution of care was very rapid. And the research that went along with that. And then I think the other lesson for me is just, as I've said, the power of being a part of an integrated network and Sutter Health's ability to redeploy employees to where we need them, our ability to move equipment and supplies, PPE and other things around the system, and how we developed processes and systems and technology to be able to do that very rapidly. Really showed the value of for Sutter Davis to be a part of a large integrated health system.
Thank you very much. And the learning curve in our health systems has just been absolutely profound in the last year. So Supervisor Provenza, same question. So what has been the biggest shift for you, and what have you learned from this time? Oh, and you're on mute.
Thank you. I guess the biggest shift has been the recognition that the county government has to work in a way that is entirely collaborative. As Dr. May suggested, that the collaboration comes out as a prime factor. We initially had to be all hands on deck. We didn't have a public health department that could handle a pandemic. We had a very small unit within our community health division. We had to move people from other departments. We had to shift staff. I remember a staff person who I worked with on wildlife issues and habitat preservation told me one day, hey, I'm on the pandemic now and I'm being trained and I'm doing this. Well, having the ability to collaborate within our own county government, but then in a broader way. It would not have worked at all if we tried to do it alone as a county. Now, for example, we were trying to make sure that nonprofits continued to survive throughout this process, because many of the low-income people, many of the people affected by the pandemic also benefit by the nonprofits. And then the Yolo Community Foundation was essential in figuring out who needed help and targeting that help. That's not something that, in many ways, even the giving of that type of aid is not something the county could do directly. And having Yolo Community Foundation there was just essential. Being able to work with the university. We share a population of students who live in the city, but also go to the university every day, and making sure that that everything worked together, that people were tested. And of course, the university's done a tremendous job on the testing, but making sure that everyone was complying with all the rules that were essential, the wearing of face masks, the distancing, that we all worked together to make that happen. Initially, the county was responsible for the first health order before the state made its orders. And that was difficult because we had to tell businesses that they had to shut down. They couldn't have customers, that they would be affected, obviously, economically. We had to tell individuals that they're giving up some of their personal freedom, and we had to convince them that it was a good idea. So the other thing that was mentioned by Chancellor May, communication was just essential, because we had to convince people, not only is this important to do for yourselves, but it's important to do for your community, that type of sacrifice that we all had to make was essential to getting through the crisis. We had Jenny Tan at our communications operation, rose to that task. In fact, was named Woman of the Year by Senator Dodd the other day as a result of her efforts. But that communication was throughout the community, with the university, with Sutter, with all of our partners, and was really essential. So communication and collaboration, those were key. And then, as Rachel mentioned, being nimble. That was just so important, to be able to respond to things quickly. I'm thinking when we first started doing the vaccinations, the state had said, okay, we're gonna vaccinate nursing homes first, and we're gonna use the drugstores to do that. Well, they never got their vaccines in time, and we had all these people in the nursing homes who needed to be vaccinated. So we were able to shift vaccines from other areas. I mean, it wasn't in the state guidelines, and we probably violated something in doing it, but we had to do it. We had to be nimble and respond to that situation quickly. We had to look at individual situations that businesses were in, and although we had these general orders that made sense, we had individual businesses that were really suffering, that we could develop alternative approaches for. And some of the board members were actually doing this themselves because our staff was just so overwhelmed. For example, I got a call from an attorney who wanted to figure out a way for people to do their wills. And one of the things they had to do was come up with a way of notarizing documents so that people could complete their trusts. Well, I worked with them to set up a procedure to do that outside, distanced 6 feet away, and address a situation where certain business wasn't getting done and there was no reason for it not to be done. I'm thinking of a flower shop that wanted to operate and was able to operate because we worked with them to develop a way for them to do it outside with minimum contact to people. But that was really difficult because there was hundreds of different situations. So we had, again, all hands on deck, being nimble, figuring out how to apply the regulations in specific ways. So I've learned the importance of communication, collaboration, and being nimble. And I think I will take those lessons with me into other endeavors.
And Evan, if I could just chime in on that as well, I think having worked so closely with Yolo County Public Health, and I just want to give them kudos. Again, my colleagues across the system have shared stories and just concerns about communication and collaboration, and Supervisor Provenza hit it on the head. The Yolo County team has just done an incredible job. They've been an amazing partner, and we definitely could not have gone through the pandemic the way we did without all of their leadership and support.
Oh, I agree so much on that, and also with Sutter, I'm not going to tell about the specific situation, but I remember somebody that just fell through the cracks with our existing rules, and our health department contacted Sutter, and we fixed it because the person was in a situation where they needed the vaccine, and it just didn't fit into any of the little boxes that we have set up. And although those boxes are important, you have to also be able to respond to emergencies when they occur.
Great, well, thank you, and thank you both for that demonstration of collaboration and good communication going on between the county and Sutter Health as well. I think this theme of collaboration has come up with all three of you, so I'd like to dive in a little bit deeper into that to think about what does that really look like and how do we foster more of that moving forward. One, I think, really good place to start is with the Healthy Davis Together collaboration. So Chancellor May, I'm wondering if you could talk about this very successful elaboration that really has provided a national model for how to get testing done and how to really be just incredibly proactive about creating our bubble here. So would love to hear from you about what you've learned from that collaboration and what you'll take from that into new endeavors.
And the question is timely. There was just another mention of Healthy Davis Together in the New York Times today. So we are getting a lot of attention for the program. The city of Davis and Yolo County really benefit from having the UC Davis Genome Center and the university right in the backyard. As of today, the center has actually processed more than 450,000 saliva samples since the pandemic began. That's a lot of spit. It's taken a tremendous amount of coordination and teamwork, as we've alluded to make all this happen. We all hope we never have to face such a situation again, but if we do, at least we know that we have the blueprint now, right, for a successful program. And it's been critical to have established relationships, maintain positive partnerships like these throughout the entire crisis. When there are challenges as well as opportunities, we've shown that we can work through them together. Healthy Davis Together came about because we were fortunate enough to have had some previous history with not only the work in the Genome Center, but also some benefactors, private benefactors, as well as some resources through the CARES Act and other resources internally. And we decided to, since the virus did not know any boundaries, right? The virus was not going to be confined to our campus. We said, what can we do to make the entire community safer? So we got in contact with the elected officials in the city, the business community, and put the program together with the dual objective of keeping everyone as safe as possible, but also helping the business community to have a lifeline to get through this, right? We don't think we made them thrive, but we made them able to survive through this last year, through all these various programs associated with the HDT. And, I guess I'm really proud of the attention, but I'm really also more proud of the fact that we've kept people safe and hopefully alive, right? We've had a positivity rate of about 1% compared to the state positivity rate for the virus of around 6%. And that doesn't happen without this kind of the technology, the epidemiology, the collaboration, and the communication. It's just important to seek input from wide numbers of stakeholders in creating a program like this. No single person or no organization has all the answers by themselves. So that's where collaboration begins. We have to have open dialogue, clear goals, and a shared sense of purpose. And I couldn't be more proud of the program.
Thank you very much. Yeah, it has been just a shining star in our community. And I think let's dive a little bit deeper into the idea of collaboration and how we foster it moving forward. Supervisor, you spoke about working with businesses, working with nonprofits, kind of what are you seeing out in the community that you really want to take forward when it comes to collaboration, and how do you think we might be able to draw from what we've learned and carry it forward when it comes to collaboration?
Well, we actually have a pretty unique opportunity going into the recovery, post-pandemic recovery stage is what I'm calling it. The cities, the county, the state, all levels of government, the school districts have been given quite a bit of money to spend on COVID-19 recovery. To give you the idea by way of scale, our county every year in our budget, when we finish paying for all the things that we have to pay for, we feel really lucky if there's $500,000 left to spend on the things that we really want to address. Well, this year, and it will actually be over a couple of years, there'll be a total of about 42 million to spend directly from the federal government, and cities and the school districts will get similar amounts. We have an opportunity to address some bigger issues. Although it's one time, we have 3 years to spend the money. And we're looking at things like housing, looking at things like childcare and preschool, looking at racial and ethnic equality, looking at lack of access to medical care, how disadvantaged communities have suffered during the pandemic. We have to all work together to figure out how to spend those funds. And there's a tremendous opportunity if we do it correctly. For example, if we're addressing homelessness, the cities and counties need to figure out who's going to do what and how best to spend the money to in a transformative way, to build for the future, and to do it in such a way that we begin addressing problems on a long-term basis. So we, as a board, decided to begin that collaboration immediately. We are bringing up in all of our what we call 2x2 meetings, where 2 council members meet with 2 supervisors to begin that collaboration, and also with the university. I think we can take issue by issue and figure out what we're going to do, and then we also have to know what the state's going to do and what the federal government's going to do, because they're all going to be focusing efforts. And if we collaborate with that, we can be very effective. If we don't, there's a potential for a lot of overlap and waste of funds. So that collaboration is going to be the most important. And I'm very confident that we can do it in a transformative way.
Yeah, thanks for that response. And I think, we've had to be so collaborative in emergency response, but there's a very strong call to action in moving forward as we think about recovery and spending funds and really addressing critical needs. It's a different type of collaboration that's required, but still very, very important. Ms. McKinney, on the topic of collaboration, you mentioned the integrated network that you've of your system, which is as a health system a little bit different than either a local government or an educational system. How are you thinking about collaboration and what you want to carry forward?
Well, like, a lot of the comments that have already been made, I think, building on the partnerships that have been created throughout the pandemic, but then also as a not-for-profit healthcare system, we really, partner with so many community agencies to do what we can to care for patients outside the walls of the hospital or outside the walls of the clinic. So as an example, our partnership with Yolo Food Bank and their nonprofit partner organization to be able to provide access to healthy food and to help impact food insecurity. And how do we leverage existing partnerships and collaboration and take them to the next level? And to Supervisor Provenza's point, there's not an unlimited supply of resources. And so to have redundancy and to have waste, we're stepping over each other. We really have to continue to come together to leverage those resources, particularly as we figure out how to recover from a financial perspective and help businesses continue to thrive in the community. So the collaboration, building on existing partnerships, and really taking time like we're doing today to reflect on these things and what has worked well and what has opportunity to be improved or enhanced as we go forward, rather than just charging forward and quote, getting back to normal, because we've all had so many lessons and we've learned so many things about collaboration and how we can better communicate with each other in the community to help support the needs of organizations and communities. And I think we have a real opportunity to continue to do that.
Thank you for that. And I think that all of your comments, I think, lead to our next topic, is really looking at those communities that have been most impacted by the pandemic and the ways that the pandemic has put a spotlight on racial and economic inequities. These have long existed in our communities, but we've seen these come up more intensely, and we've seen, we've really starkly seen the needs that we have in our communities. So I think, talking about leveraging our resources, working together, what are some other thoughts that you all have about how we can work to address inequities as we come out of the pandemic, and what should some of our main focus be? And maybe I'll turn back to Supervisor Provenza to answer first.
I think we can address these on an issue by issue basis, and then bring everybody together, both in the public and private sector, and look at what the gaps are. And we did discover some of those gaps during the pandemic. We have been doing, for example, food insecurity. We've been doing a lot to provide food to people. But what we discovered gaps, a lot of gaps of people that weren't receiving proper nutrition prior to the pandemic. And of course, it's worse during the pandemic, but it did kind of expose that as an issue. So we should all get together and then identify what those gaps are, and then look at what everyone's already doing and what they can potentially do, and develop a plan to address it. We should be at 100% food security. We shouldn't have a food security insecurity problem in the county, but it keeps coming up. Housing, more difficult in a lot of ways, but we have the opportunity to address it together in a way. And we were already doing that to a certain extent. The county was working with individual cities on projects to address homelessness, but I think we need to do it in a broader sense and ask what housing do we have? What are the gaps in that housing, and how we can together address it? I was just speaking to the representative of our employee union the other day, and one of the points he brought up is they have a fear that some of our employees won't be here in the long time because housing is too expensive. So how do we meet that gap? Well, it's not something we can do alone. And then a lot of it is interacting with the state, advocating with the state, and coordinating with the state and federal government. The real beautiful thing right now is we have a state and federal government that want to address these issues. And we need to be an integral part of that, not just these separate efforts. So we collaborate locally, but with an eye towards what other levels of government are doing, and we can influence what they're doing. So I think an issue by issue analysis in each of the areas that we can identify, and then committing to each doing our part in addressing those issues.
Thank you for that, Supervisor.
Welcome.
Chancellor May, I'll turn to you. How do you see this playing out within the educational systems, and how do you think we can best address the inequities that have come out so starkly from the pandemic?
Well, Evan, as you rightly framed the program, this is a problem. This is a problem that has persisted for many years, and the pandemic has only further exposed some of these issues. I think we need a wide range of initiatives to address inequities that persist for women and people of color. As our Office of Diversity, Equity, and Inclusion says, it's time to move from being an ally to being an advocate. That means making a concerted effort to enhance diversity by providing access and opportunity and advancement for all. It starts by looking at the inequities that exist and what's needed to address them. And we need a long-term commitment, programs that have resources behind them to sustain that commitment. In terms of the pandemic specifically, UC Davis has done some real good work, I think, in addressing these inequities. That includes targeted outreach to ensure that underserved communities are receiving the vaccine or vaccines. In one recent example, for underserved housing insecure patients at Yolo County, Healthy Davis Together is now providing about 100 first doses a day. This occurs 5 or more days a week in partnership with CommuniCare, Yolo County Public Health, and the City of West Sacramento. And we're now expanding that CommuniCare partnership to a similar clinic at the Woodland Community College site. These clinics are a growing number of COVID-19 vaccination initiatives, including special mobile clinics for hard to reach populations, where UC Davis partners with community organizations in Yolo and Sacramento counties. And since early February, more than 10,000 doses have been administered. We'd like more. We can't get enough vaccine, like everyone is saying. But this is the kind of work and community service that needs to continue long after the pandemic is over.
Yeah, thank you. And how about you?
Oh, sorry.
Yeah, go ahead, please.
Yeah, no, I agree. And as Sutter Health, as I mentioned, we serve some of the most diverse communities in the country here in Northern California, from Yolo County to the Bay Area to the foothills down through the Central Valley. And racial and economic disparities and inequities have long been a priority for our organization, and the work our Advancing Health and Equity team is doing and has been doing for several years is really helping to play a role in using data to identify and shape how we can address the inequities, specifically looking at maternal health, chronic disease management, opioid prescribing practices, cancer screening, and then now COVID-19. And so last July, that team worked on a research and published a study in Health Affairs that really highlighted what we knew, that COVID-19 was having a disparate impact on our diverse communities, and particularly African Americans at a higher risk for hospitalization from COVID-19, and our ability to highlight that and show that and to be able to start to take action. We're also doing that same work. As I said, we've learned a lot about the disease, but we're still learning a lot about COVID-19 and pregnancy as an example. And so we are launching a maternal cares study, COVID, let's see, it stands for COVID antibody race and ethnicity study. And there is information on our website. I know we can try to get that link out. But for women that come to the hospital that are about to delivery, we're creating a biobank to really understand how COVID-19 has potentially can impact. And so we've also worked with Communicare was mentioned as well. And so using our community health needs assessment and identifying diabetes as an example, being able to collaborate with Communicare and help support the work that they do with disease management and outreach, diabetes education to better serve communities in hard to reach places. So we've certainly been able to foster those collaborative efforts, but it's not enough, and we have a lot more work to do.
I would like to give maybe one example of an area that has been so important during the pandemic, which is the broadband access. As we know, the state system is set up on being able to access appointments through the internet, and our system has largely been as well. But there's whole communities that don't have access to the internet in that way, and that gives them a disadvantage in getting appointments for the vaccines, but has also been important in other areas. For example, when we were doing, the schools have been doing learning over the internet, learning at home. Well, students that don't have access to the internet are disadvantaged. When we opened the Migrant Center, we realized there was not only no broadband access, but that there were difficulties even figuring out how to extend it. We did extend it there. Now we've done a lot of workarounds. We've set up through the county's 211 information system, an ability of people to have someone else sign them up when they call in. We've had direct calls to seniors and offers of assistance, but that's a Band-Aid. And one of the things we can do going forward that shouldn't be that complicated is to make sure that every single person in our county has access to broadband, knows how to use the access, and has the tools to use it. Has the computer, has the ability to access a computer, and those things are also possible too. I think I know that out ahead on that is the Aging Alliance working with seniors, but that's true for minority communities. It's true for everyone else. It's just not something nice to have. It's going to be like electrification or extension of phone service nationwide. And that's something that we can all get together and make sure it happens for the next crisis and the rest of this crisis.
Well, and to your point, Supervisor, the access to the internet, when I talked about expansion of telehealth, that's a barrier.
Yes.
And so while we look to telehealth to expand access to care in rural communities or hard to reach places, that element of access to the internet and competency around use also creates a new barrier, a new inequity that we have to work to address.
Absolutely.
And Chancellor May, I think, there's been such a profound shift in the way we're using technology across all of our systems, but education has seen that significantly. How is that playing out for your students, and where do you see how do you see kind of the way the university is interacting with technology changing as a result of the pandemic?
Well, you would think that our students, being digital natives, would have had no problem with this shift, right? But not so much. And some of the reasons were mentioned in students that come from areas where there is not widespread broadband access or good technology in the home, have had some difficulty in this remote learning environment. So we try to do all we can to, first of all, we keep the campus open, even though we're not teaching classes in the classrooms. Students can come to campus and get a signal if they need to do that, right? And we've done that since the beginning, since last March. We've also provided equipment, hardware, to the disadvantaged students who needed it. So we passed out laptops and other connectivity enabling equipment very early on, and let students keep that throughout the pandemic. But it does really highlight the fact that even though these are students going to a top institution, they are still some there among that population that are underserved and needing some assistance.
Good, thank you. First of all, I see that people are starting to put questions in the chat, so thank you for doing that. And please keep questions coming. We're reserving the last 30 minutes or so for audience questions. So I'm gonna let that roll, and then I'm gonna turn to the questions here soon. One thing I did want to do, referring back to Valley Vision's public opinion polling, we saw through that work specific issues and populations that are being impacted in specific ways. And so each of you kind of touched those different communities in different ways. So I wanted to ask you questions about that. And Chancellor May, I'll start with you. We saw throughout our poll that young people who are launching into their lives are experiencing specific setbacks about, and that translates to more depression, more anxiety, and of course, economic impacts and economic setbacks in their lives. When you think about bringing students back in person and thinking about kind of moving on from where we've been with the pandemic, how do you think young people need extra supports, and what are your thoughts about how UC Davis can address those?
Well, I do know how tough the pandemic has been on young people, not just because of our students, but as the father of 2 daughters under the age of 25, right? Both are recent college graduates. So the isolation and disruption in our world has made it difficult to focus. And with economic devastation from COVID, younger people may actually be questioning the kind of working world they'll be entering and what careers will still be viable in this new world. So one of our goals at Davis is for every student to have a job offer in hand or acceptance into a graduate or professional program in hand when they graduate. And we try to do that by offering a wide range of internship and mentoring resources across the campus. We also have a leadership job shadow program where students can spend time with senior leaders on campus and learn what they do, including myself. In terms of students holding back on their educational opportunities, we're actually seeing the opposite of that at Davis. This fall, we had a record number of applicants for our School of Medicine. And we had a record number of applications for first-time freshmen and transfer students. We had a total of more than 105,000 applications, which is about almost a 12% increase over the previous year. So when they get here, while they're here, we'll do all we can to support them, from career counseling to a variety of mental health resources. The more we can provide support, especially during times like these, the better chance they'll have a fine and great success in the next chapters of their lives.
Thanks. And Supervisor Provenza, thinking about jobs and the economy and the way that the pandemic has significantly increased unemployment, and we've seen quite a lot of income reduction even in people who are still employed at some times. So when you think about inclusive economic recovery for Yolo County, what do you think some of our top priorities are, and how do you think some of those needs should be addressed?
Well, I think the top priority should be to identify the people most affected by the pandemic, the people who did lose jobs and either haven't become reemployed or are in jobs that do not pay sufficiently to support their family. And then people that may have lost their jobs, they're working again, but suffered economically and not yet recovered. I think we have to, when we have received resources from the federal government, and we have to make sure we get those resources to the people who are most in need, because a period of unemployment can affect a family for the rest of their lives. It really can. I remember a period where my father was unemployed, and in my memory, he was unemployed for a year or two. He told me it was only 2 months, but it had such an impact just being in that situation that I remember it to this day. So we have to recognize that the families who've gone through this need economic support. And then if they've suffered educationally in the schools, that's an area that we need to collaborate and make sure that we give them the resources they need, not only in the schools, but through the mental health system, and identify the areas that we all can help. But a focus on these families that have suffered the most is going to be essential.
Yeah, thank you. And I think, I think retraining opportunities as well. I mean, I think that people might
Yes.
have to come back to different types of jobs.
And we need to look at what the county can do to increase employment. And that's always been a challenge. But I think we can, for example, make greater utilization of some of the union apprenticeship programs, where a young person can take a job as an apprentice. They can earn 30, 35 an hour while they're an apprentice. And then often when they make it into the trades, they're earning 70 an hour. And these are young people that may have decided not to continue with college education, or perhaps they have, but in either event, it's a tremendous opportunity. And I think we need to do a lot more of that. And then a lot more economic development, including bringing companies in that can provide well-paying jobs to our young people and to people that have lost their jobs during the pandemic.
Yeah, thank you. And then Ms. McKinney, you mentioned early in your comments that you were redeploying team members and that there was some internal kind of workforce training going on within the Sutter system. Any specific takeaways from that, and where do you see that going within your system?
Well, I think to start, I mean, the willingness and the openness of the employees to step up and say, I'll go, where do you need me? I'll go wherever you need me. And I'm willing to learn, and I'm willing to transfer. I'm willing to drive to Modesto. I'm willing to go wherever you need me to go. Just that willingness and openness and being able to do that. And then of course the virtual capabilities allowing us to scale that retraining in a different way versus having everybody go to San Francisco or Sacramento and sit in a classroom. So our ability to really continue to do that and continue to offer retraining programs to help us fill critical needs. I mean, healthcare has always had challenges with nursing shortages and physician shortages. And I'm glad to hear the applications for the School of Medicine is up. I mean, that's certainly something that we have struggled with throughout the decades, and we continue to. And so being able to help create some of those programs to allow us to continue to support where we have those critical gaps will be really important. And then just the overall, to build on the point about how this has impacted people from an emotional or mental health perspective, certainly we know those were critical issues before the pandemic, and those have been exacerbated, and those have been exacerbated for many of us and for our workforce. And so from an academic perspective, from a workforce perspective, it was really important and really critical for us to be able to provide resources and tools for our employees and their families throughout the pandemic. Employee assistance programs, we brought counselors in, because taking care of patients who are isolated because they can't have their family in the hospital for safety reasons, that has probably been the biggest challenge for our employees. And so you're starting to hear, unfortunately, a lot of statistics about nurses and others who they're going to start to walk away from healthcare. And so while we can talk about retraining, we also need to talk about retention and how do we take care of our clinical staff, our nurses, our doctors, so that they can continue a career that they were called to, and we can continue to mitigate those staffing shortages.
Yeah, and I wonder, across our frontline workers, with healthcare being really premier frontline workers, what kind of PTSD impacts we're going to see as people go into less of an emergency response mode and more into a recovery mode. I think educators, like I said, healthcare workers, there's going to be, and others, I think there's going to be some significant impacts from everything that we've been through.
Mhm. Well, and I think highlighting the resources that are already available. This community is rich with resources, and certainly we have gaps and we have opportunities to build on things, but sometimes it's just a lack of awareness and not knowing that something's available. And so how can we all help to promote each other? How can we promote the nonprofits in the community and others and the work that they're doing to make sure that people have access to what already exists, and then continue to build on that and continue to identify those gaps, and Supervisor Provenza said, tackle them one at a time so that we can really make an impact.
Thank you. All right, I see some questions coming up from the audience, so I'm gonna go into some of these questions, and I'm not gonna go in order because some of them are directly related to this conversation. So I'll start with one for Chancellor May. It says the SAT and ACT are gone for the time being, but what does that mean for language and lab prerequisites? Subject A, is the faculty sensitive to their need to take on a more remedial role? So I guess, part of that question is there's impacts this year. How does that affect next year and the protocols that you use?
Yeah, that's a good question. As most of you know, the University of California system is no longer using the SAT for admissions evaluations. And I don't think that means that we are taking a turn toward remediation. In fact, just the opposite. We don't see ourselves as a remedial institution at the UC. I do think there are some other mechanisms for student preparation that have to be strengthened and explored, including, first of all, in their K through 12 experience. We have to make sure that the school systems are providing the right kind of preparation for the students to get ready to come to a UC. But in addition to that, not all students, even should they be accepted, not all students would be best served by an immediate start at UC Davis. Maybe a community college route might be more beneficial for some. In addition, we'll be doing the summer bridge type programs, beefing those up and scaling those, and orientation programs that will help students make that transition. But we really don't see ourselves as a remediation place.
Okay, I'm going backwards in the chats. I'm looking at a question from Michael Bish. Hi, Michael. He was surprised to see the level of optimism of this group in that first poll question that we had, and is pointing out that, let's see, while there has been success for celebrating, the pandemic has shown across the board that we have not learned how to correct systemic socioeconomic injustice, particularly at the local level. How do we, as a community or region, drive fundamental change to the actual system so our most vulnerable neighbors can experience the same sense of optimism? So this is getting at really, how do we reimagine these systems? And I've heard a lot of themes so far around leveraging resources and collaboration, focusing on the communities most impacted. Anybody have anything to add about really fundamentally changing the systems at the local level? Oh, Supervisor, I think you might be talking, but you're muted. Yeah.
Okay, sorry. I think what I was referring to before is really doing kind of an issue by issue approach, and food insecurity is one at the top or toward the top of the list, where we get together as a community with not just government, but nonprofits and the private sector and the healthcare system, and examine where we are and where the gaps are. And I think we're in a much better situation to identify the gaps, and then look to what we can all do to address the problem with some very significant goals. And I think with food insecurity, the goal should be zero food insecurity by a certain date. And Michael, you're going to appear before the Board of Supervisors on this topic, I think, in one of our soon to be upcoming meetings. So I'll be happy to hear your thoughts on that as well.
I will say, I'm not really surprised. I saw Michael's question in the chat as well. I'm not surprised that people are optimistic because there's been so much bad news for so long that finally we have, a glimmer of hope with vaccines, et cetera. So I think people, it's human nature. We want to be optimistic and we want things to be better. I do think it's important to remember what the governor said, in that, we want to basically said we're not going to go back to normal because normal wasn't good enough, right? So as we rebuild and recover, we have to make sure that we're trying to do it in a way that's better than where we were before, not the same, or certainly not worse.
Yeah, I agree, Chancellor. I think it's a good time to be optimistic. Of course, keeping in mind the really severe hardships that are happening in our communities, but as both spring is coming and vaccinations are happening, it's nice to think that we might be at a little bit of a turning point, and that we are poised to really examine the systems that are in place and have our eyes wide open about how we can improve them.
Well, and Evan, I think also, just to touch on that, I think that the pandemic has forced all of us to reevaluate what's important and what our priorities are. And that has created room for us to focus in a different way. And so I think if we continue to reevaluate and evaluate where we're investing our time and our resources and leveraging those partnerships, it will create space for us to really continue to tackle those issues. Because what's most critical now for us in our community was maybe not what was most important prior to the pandemic. So when we say after COVID, COVID's going to be in the community for some time to come. And so how do we continue to evolve and grow as a community, take what we've learned and continue to build and leverage that as we go forward. But we have to figure out, how do we adapt and how do we evolve as we reopen and as we start to get back together. But we also have to recognize that COVID will continue to be in our community, and we have to continue to take precautions. We have to continue to encourage people to be vaccinated. And that will help us continue to make progress in getting back to where we need to be, or better than we were before.
I want to add one point there. I agree with you, and it is going to be with us. And we had a recent board meeting that we conducted on COVID-19. We talked about the light at the end of the tunnel, and people are beginning to see the light at the end of the tunnel. And there's everyone wants to declare victory and move on to the next thing. But the important thing for us all to remember is that the light of the end of the tunnel is much further away for some people, and the crisis isn't over once everyone's vaccinated and once you don't have to worry about the virus. And I think if we keep that in mind, our emphasis, our priority going forward will be, okay, how do we get the rest of the people through this? The people whose mental health has been affected, the people who have their income and jobs affected, the people who are suffering some of the lasting effects, the long-termers on the COVID virus itself. We have to keep that at the top of our priority list as we go forward.
Okay, and I think that actually is a great time to turn back to our audience. We have two more poll questions. I believe that kind of are focusing on what are some of our priorities as we reimagine. So I'm going to ask Holly to launch those questions. Great. So the first one we have, what areas do you want to see more focus? And you can check as many as apply. And the second one's oriented towards how are you prepared to support? Let's keep that open for just another minute, and then Holly will share our results. All right, Holly, do we have our polling results? All right, so our first question was, as we come out of the pandemic, I hope our community focuses on making change in the following areas. So our number one response is greater focus on racial and economic equity. But we see a high degree of interest, first of all, in all of the above. And next on more focus on capturing innovation and new approaches to meeting community needs. Good, and I think this conversation and conversations like it are a good way to start doing that, really thinking about what are we doing that's working well, where do we have gaps, and how do we approach those gaps. Okay, the second question, I'm prepared to support our recovery in the following ways. We have 70% who are willing to donate to nonprofits. That's awesome. 70% learn more about how to disrupt systems of racial and economic inequity. And then we have more than 50% serve as a nonprofit board member, volunteer for nonprofits, and give directly to my neighbors in need. Those are all great calls to action, and I'm sure Jessica will follow up with how you can activate some of that. That's great. So thank you everybody for participating in that. And I think we have just a little bit of time left, and I wanted to, maybe my last question for the panelists are, we focused a lot on learning and on the hardships that our communities have endured throughout the pandemic. I also want to make sure we're thinking about, and we've talked about it, but some of the really positive things that have happened, the things that you're most proud of and really want to see carried forward. So let's leave on that note, and I'll start with you, Chancellor May.
Sure, thank you. First, in response to the last poll, let me just remind everybody that the university is a nonprofit, and you can certainly give to this nonprofit. So, what am I proud of? I couldn't be prouder of our UC Davis community throughout this pandemic over the past year. That includes our 250 undergraduates who signed up to be what we call Aggie Public Health Ambassadors. They help make sure the campus community stays safe, from handing out free face masks to guiding people to the testing locations. I'm also thinking about our students and staff who distributed food at the Aggie Campus Basic Needs Center. Other members of our UC Davis community have worked with the Yolo Food Bank to deliver goods to seniors. You may have also heard about our Staycation Grants, which we've given out this week for students willing to stay in Davis for spring break to limit their travel. Initially we were going to give out 500 grants of $75 each in the form of $75 gift cards they could use at various Davis businesses. The response, however, was so tremendous, we wound up giving out nearly 4,000 of those grants. So it got a little bit expensive, but we did it. A little financial incentive is certainly nice, but overall our students have really done a tremendous job in showing their resilience and willingness to help slow the spread of the virus. I remember back in the beginning when there was a lot of nervousness here about our students coming back and being spreaders of COVID. And it's kind of ironic at this point with the testing program, things that we're doing, the positivity rate among our student body on campus is lower than the overall rate in the city and county. So some of the students joke and say, we're afraid of the people outside of campus who might give us the virus. But at any rate, just kidding. I have a lot of hope for the coming year because of all the goodwill that we find around Yolo County. I think when times get hard as they've been over these past several months, we not only show a lot of strength together, but we show a lot of heart together and resilience. So I'm proud of all those things.
Absolutely, thank you for that. And before going to the next panelist, I'll also ask those of you in the audience if you could put into chat what are you seeing around the community that you're proud of. I think that would be a nice scroll to see as we're talking here on the panel. So I'll go next to Ms. McKinney. What are you proud of that you've seen?
Well, I think the thing that I'm most proud of is just seeing how the community came together to help respond and help us prepare for a potential surge when the pandemic first started. And really everybody immediately stepped up, and we saw so many people reach out to the hospital. How can I help? I have PPE. Can I donate PPE? donating to our philanthropic foundation to help support our expansion of telemedicine, and to be able to provide us with other equipment that we needed to be able to care for COVID patients. We saw all of the nonprofits in the community just scale and jump into action. Yolo Children's Alliance, Yolo Food Bank, Communicare, just everybody pivoted and really modified their business models and really got creative and innovative to continue to help and put the needs of the community first. And I think probably even more proud than that, I'm just really proud of our workforce. I'm proud of the resiliency of our healthcare workers, the sacrifices that they've made, the positivity and the optimism that they've given and that they've shown, and that they just continue to show up every day to take care of patients and have a great attitude and really care for each other and for this community, and continue to fight for the health of the community. So really proud of everybody coming together. And as far as hope for the future, I mean, certainly the vaccine helps bring hope to where we want to head. And I think, hearing the discussion today and the optimism also brings me hope that, we'll continue to thrive here in Yolo County.
Thank you. How about you, Supervisor?
Well, I'm very proud of our county employees who were willing to work such long hours and many times place themselves at risk, and not questioning the need to work outside their job and to do new and different things to handle the crisis. The all hands on deck was just tremendous. Proud of our County Health Officer, Dr. Amy Sisson, who just works day and night to make sure that all the issues are addressed and that we're able to maneuver our way through the crisis. I'm particularly proud of all the volunteers. Anyone who's been to a county vaccination clinic will see that so many of the people there have volunteered their time, not once, not twice, sometimes 10 times. They're coming every weekend. I'm proud of the effort to address some of the access issues. For example, the setting up of a clinic for farm workers, going out to the fields to provide vaccines. The farmers that have contacted us and said, "I want my workers vaccinated. What do I do?" And we've had volunteers and county employees going out and vaccinating people right on site. The same with healthcare workers, the same with, for example, childcare workers. A high percent of the childcare workers, particularly smaller operation and the family and friends efforts, are Latina, 60% Latina. We had the employees at First Five not only volunteer to help, but everyone from the lowest level to the executive director actually calling people to urge them to come in to get their vaccines because they were addressing maybe a reluctance or a lack of ability. Just people stepping up from all over. The woman in Woodland who made hundreds of masks before, you may remember, before we could go to the store and buy them when there was a shortage. She just made hundreds and then put out a call for material. Because she ran out of material, and then people stepped up and responded to that. The community came together in such a wonderful way. And I think for the future, optimistic for the future, that we will bring these lessons forward with us. And I'm convinced that we can. And we're addressing another crisis in the future, the climate crisis, which is kind of like the pandemic, but slower moving and more long-term, but with consequences perhaps more severe. And one of the things that I've heard from the community and that we're going to do is, well, let's address it in a way that we also address racial inequality. Let's address environmental justice. Let's make sure that if we produce jobs in this effort, that those go to minority communities. Let's make sure that there isn't a disparate impact on the minority communities in setting up this effort. And we're in the process of doing that now. So I feel both proud and optimistic, and these are opportunities for us, but we have a lot of work to do, and we have a lot of work to do together. Thanks for doing this forum for us today, for putting this together. I think we did need to do more, have more opportunities like this. Thank you.
Yeah, thank you, Supervisor. And I join you in saying thank you to Yolo Community Foundation for putting this together. This has been a great panel, and I think, you know, taking a moment to reflect, to think about the lessons learned. I think also to really celebrate the resilience that we've seen in our communities, while also acknowledging there's a very significant call to action in front of us. And in some ways, recovery, I don't want to say it's more difficult, but I think it's difficult to sustain because you don't have such immediate needs in front of you. And so you have to really continue to stay focused on, you know, on all that the pandemic has laid bare in our communities. And what I hear from this panel is a commitment to do that. And to be thoughtful coming out of where we've been already with the pandemic. So I've also really enjoyed reading the comments in chat about what people are seeing in the community. So I appreciate that too. And I'll say thank you to the panelists, and I'll turn it over to Jessica again.
Thank you. And thank you so much to our wonderful panel for sharing your tremendous expertise with us. I also want to say a tremendous thank you to our participants for joining us today and throughout this series. It's been such a pleasure to see many of your faces return week after week. I've learned so much over the past month. I've been moved, inspired, and motivated by the tremendous expertise and stories that our panelists have shared with us and the work that they're doing in our community. We at the Yolo Community Foundation are working to figure out what we do next with this information so that we can do our part in the recovery. And I hope that you'll do the same by doing what so many of you indicated you would in the poll: donating, volunteering, joining boards, participating in local government, and otherwise working together to make our community better for all. You'll find the recordings and summaries of all the panels in our series at yolocf.org. And please don't hesitate to contact me if you're interested in collaborating with the Yolo Community Foundation. Thank you so much for joining us.